get to sit with undivided attention with someone for an hour just to
Mm-hmm.
see how they're holding. That's just unheard of in healthcare, and that's such a gift in hospice because
Mm-hmm.
that's every teammate is expecting that, and that patient gets that. And I just think that's a beautiful thing to
Mm-hmm.
have at end of life.
This is Jerry from Touching Hearts at Home here in Coeur d'Alene, Idaho. Today we have Shawna from Hospice of North Idaho. I'm going to go ahead and have her do an introduction of herself because I probably won't get things right. So Shawna, go ahead and do a quick introduction about yourself.
I'm Shauna. I'm the Director of Clinical Services at Hospice of North Idaho. I have been in hospice care for 13 years, and I've been with Hospice of North Idaho for 12 years. And my background started out as a nurse in the field, and I've had a lot of different roles in hospice and seen how it's grown and changed over the years. And so it's been my passion. So that's how I've stayed here, and it's a great organization.
What is hospice from your perspective?
For me, hospice started, I always like to talk about how hospice started out for me in nursing school. And I had this conception of that hospice is when someone's in their last days of dying and someone comes in and sits at the bedside and they're that level of care. And I had a teacher do a lecture and it just hit my heart of what hospice care is. And I knew from the moment I was done with nursing school, I wanted to be in hospice care. And what hospice care looks like to me is, it's each hospice is a little bit different, and Hospice of North Idaho for us is basically how we can support a patient and family through one of the hardest times of their life and facing things that they didn't know they would ever have to. And how do we come in and support a patient and family through that? And how the patient gets to stay in control of that care. Because one of the hardest things we see at end of life is um, feeling like you can't control what's going on with your body. You can't control what's going on in healthcare, and you can't control with your emotions. And so, well, how can a hospice come in to support you to keep that and to improve your quality of life? And so, for me, that looks like so many different avenues. So, we're really looking at HONI, our Hospice of North Idaho. HONI is our nickname. We really thrive on a team environment. And so, it's not just a nurse, it's your social worker, it's your CNA, it's spiritual care, it's a really active provider, whether it's a physician or a nurse practitioner. Um, I think what's really important to know with hospice is as a nurse, I'm a nurse and I was thinking about, we got to think about our physical needs, have we gone to the bathroom? Are we having pain? But really in hospice care, it's a complete holistic approach. You're looking at what are my emotional needs, my spiritual needs, my physical needs. And I think that's something that Hospice of North Idaho does really well. And that something I'm passionate about is that a person's not just their symptoms or their disease.
Mm-hmm.
It's about what the whole entire picture is of that needs. So typically, for someone to qualify for hospice services, there's a physician who's doing an evaluation to assess if their prognosis is 6 months or less. And so a lot of times people think hospice is, I really only need them in my last days of life. And what I really advocate for is getting hospice in earlier to just even start having a conversation. You don't even have to accept their services, just have them talking with you once a physician brings this up with you, because that way you have more of a time frame to build trust with your team
Mm-hmm.
and to maybe have that support that you need earlier on than in the last few moments.
Mm-hmm.
Hospice care, as probably you've heard before, is focused on non-curative care. So our goal is to look at your symptom and your symptom-based care and how, whether that's physical needs or, as I mentioned, emotional or spiritual, how we're looking at those symptom needs to identify, help keep someone comfortable. And that all ties into the IDT approach, which is hospice lingo for our team, which, as I mentioned, includes, our social worker and our nurse and our CNA and provider. So
Mm-hmm.
I think one of the most powerful things in hospice care that when I go to talk to nurses about hospice care is where in healthcare do you get to sit with undivided attention with someone for an hour just to
Mm-hmm.
see how they're holding. That's just unheard of in healthcare, and that's such a gift in hospice because
Mm-hmm.
that's every teammate is expecting that, and that patient gets that. And I just think that's a beautiful thing to
Mm-hmm.
have at end of life.
I believe that's how home care is. In-home care is much like that as well, where we can sit with a client or their family during the last days of a family's, imminent passing and know that we can be a support there too. So I love
Mhm.
working together with organizations like yours that we can do that together.
Oh,
It's
yeah.
it's again why I went into in-home care. It's very holistic. I love that part of it for sure.
Mhm.
Um, so why do you think that you're the only nonprofit? What does that give you that others may not in our community? I'm just curious myself.
Well, it's a little bit, to be in all transparency, it's a little bit of the national market.
Mm,
So, not-for-profits are actually kind of what they say is a dying breed. It's not very common in hospice care anymore because it's not the most profitable area.
mhm,
There is a way for for-profits to develop profits connected to their home health. But I will tell you that in our community, for-profit or not-for-profit, at the end of the day, someone is there to provide hospice care at end of life. And regardless of who they work for, that passion for that end of life care is still there. What does set us different apart as a not-for-profit is that we can provide charity care. And so that's something that we're really passionate about as a part of our mission is that we look for financial assistance opportunities to either provide discounted care or maybe it's obviously charitable care. And so we can care for a patient regardless of their ability to pay. A for-profit doesn't have that ability to do that. And so that is something that we find special to us. That's we
mm,
think about as our mission when we're trying to evaluate if we can take a patient or not. Doesn't matter if they don't have insurance. We're
mm,
figuring out how we can bring them on and
mm,
take care of them and that their care level doesn't change. And so that
mm.
is something that helps serve our community. Our partners know that we will take patients regardless of their ability to pay. So that is something that does set us apart from for-profit.
Definitely.
And honestly, Hospice of North Idaho, we started in the 80s
Mm,
and it started with, and you probably are familiar with this, but I mean, it started with some of the core original kind of healthcare individuals at the very beginning, early on, Kootenai Health, and
mm,
when they were KMC, and it was
mhm.
just volunteer based. I mean, no
Yeah.
one was getting paid; they were just volunteers, and that's where we grew from. And
Mhm.
so we never want to lose our grassroots and why we are doing what we're doing because our community needs it.
But I realized this more recently that hospice can help with medication management, not
Mhm.
just for pain, but maybe for dementia symptoms. So can
Mhm.
you explore that with us just a little bit further?
When we are evaluating a patient for hospice services, one of the things that Medicare looks at is, what's the primary reason they're coming on a hospice services? So one of the parts of that is looking at when we meet a patient and we know that maybe their prognosis is 2 to 3 months.
Mm-hmm.
We Each person is unique and different, and so I want to say that always. So when someone has a certain disease process like heart failure or kidney disease or cancer, there's a certain progression of symptoms that we're looking for. So
Mm-hmm.
sometimes it might not always be pain control. It might be we need to help keep an eye on, make sure this person's swelling in their legs is managed, or what are things that we can do to help prevent that? Are we worried about shortness of breath or looking at someone's basically what they're experiencing, what they're communicating, and being able to respond to that?
Mm-hmm.
Sometimes it's nausea, or sometimes it's constipation, sometimes it's fatigue. And
Mm-hmm.
so we're thinking of ways, whether pharmaceutical or non-pharmaceutical, and how to support that person where they're at. And sometimes it's as simple as their blood pressure is running lower. So we need to adjust their blood pressure medications. And that's where we're really lucky that we have really active providers, our physicians and nurse practitioners, that they're a phone call away. And
Mm-hmm.
that's one of the benefits of hospice is that you have at your fingertips a nurse 24/7, and then they have a provider at their fingertips. And Medicare requires that. And so you should be able to make active changes even in the middle of the night. Not that anybody's really worried about a blood pressure in the middle of the night, but say you have a new symptom in the middle of the night, you have a nurse and a physician who can get you what you need to help manage your symptoms more efficiently and timely. And
Mm-hmm.
that's one of the things that's really for my role and for my staff is quality and timely care
Mm-hmm.
because you have loved ones who have not, maybe they haven't been in healthcare and now all of a sudden they're somebody's caregiver. You've experienced this in your world probably. And
Mm-hmm.
now all of a sudden they're managing all these medications and their loved one, and to have that support is unheard of.
I also appreciate how you can have community care with one provider dictating all the things as opposed to polypharmacy from a variety of providers. Often it's one provider, and I so appreciate that. That's decreases medication management errors and so many other things. So
I would say that one thing that our providers have really, we have a Dr. Leah Jones, who is our new medical director, brings years of experience, and she has just developed this relationship with providers in our area, physicians, and she'll call and say, hey, this is something that you were doing for your patient. Why? And I think that's just been a huge benefit for our patient population. Yeah, just it's for their safety, their management.
So give us one last tidbit for us to know about HONI, Hospice of North Idaho, or just hospice in general that we can leave our audience with, or a call to action.
I think it's important to know that I'll speak for Hospice of North Idaho, and hospice's goal is to travel with the patient on their journey. And so whatever that journey looks like, and sometimes I think the common misconception is that people think about, when I start hospice, that's it, I'm on hospice. And a lot of times, and yes, that can be true, but a lot of times people forget that they have a choice in that, and so a lot of times they'll push off wanting to start hospice because they think once I commit to hospice, that's all I get. And what I encourage for the community is and I know other hospices, invite them in your home to ask questions. You don't have to sign up for their services. You don't have to make any commitments. You can just invite them to come and get educated on what's available to you and what resources there are. And I think that's really important. And I think just having information and knowing that you can ask that is really important, because feeling like making a commitment to your comfort at end of life is huge, and you're allowing strangers into your home and building a trustful relationship. You want to know who you're meeting. And so I would say, if you're questioning about, do I want hospice, know that you don't have to commit to it, and to just invite whoever it is into your home to meet them and talk with them to learn about it. And I think that's the one thing to look past, that you don't have to commit to anything.
I love that. It's just because you have a conversation doesn't mean that you're bound to anything. I appreciate that.
We have patients who go off of services because they decide, you know what, I think I want to go get stronger, and I want to go get PT, and I want home health. And we say, great, we love you. Let us know when you need us, and go ahead and go off services. And that's a normal interaction. And I think that's not well known in the hospice world.
Well, thank you, Shawna, for your enlightening conversation today from Hospice of North Idaho. We so appreciate referral partners like you and your colleagues that we work with together. Let's have coffee one day.
All right, for sure.
All right. Thank you so much.